So tonight we're going to be discussing top tips for success as a student physio at university. And it's a pleasure for me to be joined by Leesha and Izzie, two of our clinical physio buddies. It's absolutely fantastic to have you both here. Leesha, would you like to take 30 seconds to just tell everyone about where you are in your physio journey?
Yeah, sure. So I have just started my final year of my BSc physio degree at the University of Huddersfield. So last week was induction week, and this week is this first proper week of the year.
Izzie, would you like to give everyone 30 seconds about where you are in your physio journey?
So I finished uni in June this year, and I kind of took a bit of the summer off to just have a chill. And then I'd already applied for my job in, I think it was February time, and interview in April. So I started my job mid-August, and I've kind of had an introduction to the trust doing paediatrics for 7 weeks, and I'm nearing the end of that. And next week I start my full first rotation in neuro rehab in a little community hospital. So that'll be interesting.
Super duper, super duper. So we've got someone who is still at university, still doing all that hard graft, and we've got someone who's graduated, qualified, and come out the other side. So hopefully we've got two people who will be able to give you loads and loads of tips. So ladies, first of all, I think the first set of tips we were going to discuss was tips for general study, i.e. the day-to-day things that you have to do, getting yourself organized and all those different kind of things. Leesha, could I come to you first? What kind of tips do you have for people in terms of general study?
Yeah, so I have actually just spent the last couple of weeks trying to get organised for the year ahead. So I've found myself kind of comparing my university timetable for, I'd say, the first term, because I'm aware that my timetable is always subject to change. So I don't want to plan things too far in advance, but at the same time want to feel organised. So I've kind of been looking at that, and then looking at all the module specifications and the assignment briefs, because we get them at the beginning of every year, so we know when all our deadlines are. And I've just been kind of planning how long I've got to do each kind of assessed piece of work, so that I'm prepared and they can all be submitted well in time for the deadlines, so that I can kind of separate my time up into the different areas and kind of prioritise my work that way. So that's what I've found really helpful so far in preparing for the start of this new year, and just making tons of to-do lists to keep on track of things. And, yeah.
So, but I think the key thing that you've kind of highlighted there is that by looking at what you have in your timetable ahead and what the different assignments are coming up, or the different modules that you're going to be doing, it allows you to kind of put into place some really good prep so that you can allocate your time accordingly to how much you're going to be doing.
Yeah, definitely. I found it really helpful to kind of colour code. So time spent for assignments, time spent for research, time spent on campus, time spent for pre-reading, just so that I can kind of block out those sections of time. And particularly when I know that I've got a placement block of like 6 weeks coming up, where that can be quite intense and a lot of work focused into those couple of weeks. So I found that helpful so far. I hope I can keep up with it.
I'm sure. If I know anything about Leesha, she's an incredibly organised individual, and so as a result, I'm sure that method of having a very relatively focused XYZ plan works really well for you, which is awesome. Cool. So Izzie, if I might be able to come to you, so tips for general study.
Okay, so similar to Leesha, I definitely like to organise my time when I was studying. So ahead of the academic year, I'd kind of look, if our modules were out, I'd kind of look at if I had any assignments coming up, or especially the transition between second year and third year, we were starting our dissertation immediately. So it was kind of like looking at when I could fit those slots in. I would say, obviously, time management's great. I think it's very easy to overwork in physio and do too much work. And I think I got caught in that trap quite a bit. But it's definitely worth timetabling it so that you do have that downtime as much as anything. But definitely with revision and stuff, if you've got exams coming up, I think it's really handy to do work with your friends. Like I had a friend, Jess, who we would always revise together, and just in person, which again might be less easy to do now, but even if you're in your little bubble, just practice on each other for practical vivas and OSCEs and stuff.
I'm totally with you. I think when I was studying, I remembered that doing things in the groups really motivated me. I think one of the key things that I found is that you've got to pick your group relatively wisely in terms of who you're going to be studying with, because there could be some distractors in there. There could be some people who, let's say, are maybe less reliable than you may have hoped. But I think the idea behind it, Izzie, is that when you've got a group of people who understand that they're there to work together and help each other, and that you can all rely on each other because you're all focused on doing the work that you need to do, it can be really, really useful. So when I was doing it, we used to kind of meet up for whether it be an hour and a half, 2 hours or something like that. And we would specifically plan that when we finished, we were going to do this, this, and this. When we finished this, the third thing or the final thing, that's when we could chat as just friends and have a catch up about general stuff. So because that's really important that you do, interact with your friends as friends, but it's important that you block out that specific time for focused study or focused practical, as Izzie was saying. And I suppose, as you said, with COVID, we may not always be able to meet up. If you can, fantastic. If you can't, online study groups are really, really useful as well. Super, ladies. Any other tips for general study, or shall we move on to the next one?
I guess it's for like revision and things, it's about finding that workspace that works for you. So I know friends that couldn't work in their bedroom. Like I had a desk in my bedroom, and that was perfectly all right for me because it took me more effort to pack everything up and go to the library. I felt like I was moving house. So it was easier to have it all in one place. But I know people that just can't work in their like relax area, so they needed to go to a library or a cafe, or even at uni again to just revise there. I think it's important about like keeping it organized and kind of knowing when to come away from the desk if it is in your room.
Absolutely. No, I think that's incredibly true. And I think some people like having their room as the relaxation area, and therefore as a result they may well step away. But as you said, you feel more comfortable there, and as you said, you don't have to pack for the house move in order to get to the library. So I completely agree with that as well. And that's going to be a very individual choice for everyone, isn't it? You've got to think about, maybe if you're not sure, maybe have a go in doing it at home, have a go doing it at the library, have a go doing it somewhere else. If it's a coffee shop, for example, see what works for you, trial out at different places, and then focus on that.
Yeah,
awesome.
I definitely agree with that. I was just talking to a friend the other day when we were at uni about this, because they way prefer working at university, whereas I'm quite comfortable at my own desk like Izzie. But I was kind of saying I might try it this year and go to the library more, see if I find it a bit more focused, a few less distractions there maybe, or just to utilise being on campus for the days that I'm in. Since I commute, it would kind of make the travelling more worthwhile. And if your course mates are there at the same time, I feel like it's a good opportunity to make the most of the time that you have to work together. So yeah, I definitely agree with that. And then just another point that's kind of been helpful for me more recently is kind of like keeping together a track of all your feedback that you get throughout your different assessed pieces of work. So then you can look back at it at the start of the year and plan how you're going to act on that over the next year. Kind of thinking ahead can make you utilise the opportunities that you have to act on it a bit more effectively. So that's another tip that I'd have, kind of make a feed forward kind of plan.
That's really nice. Yeah, that's really nice. And it therefore allows you to specifically work on the areas that need improvement. So yeah, that's super. Thank you both. Those are some really, really good tips in terms of that. Izzie, were you going to say something else?
Yeah, I was just going to say, saying that you're going to uni more, I think sometimes like for my dissertation when I was in a real rut and I just was not feeling it, I think going to a different place and just kind of starting afresh is really helpful. But also, like you were saying, Leesha, like meeting up with friends if they're also in uni, I feel like you pick up on a lot of knowledge. It's the same in hospitals when you're working with your peers. You pick up on things that you might not necessarily know, because even if you've got different lecturers, they will have taught you slightly different things. So it's good to pick up on extra knowledge.
Awesome. Yeah, and I can totally see how other people can, as we said earlier, if it's the right people, that you can motivate each other as well. But thank you, that's super. Cool. So our next topic is useful apps and resources that you may use as a student to help you with your study. So Izzie, perhaps I can come to you first. Any top tips in terms of apps, resources that you might use?
I think, like, when I learnt my anatomy and physiology, I probably did it the hard way and wrote out every single origin and insertion on flashcards, but that worked for me because I learnt the flashcards. But I know, like, we were given Palestanga, which is like an anatomy and physiology book, which was quite helpful. But again, sometimes it goes into a bit too much detail, and can be a bit confusing. So it's like finding whether textbooks are helpful for you or not. I'd say, I know we're coming on to placements later on, but when we signed up to the CSP, like in 2018, we got a Physio Handbook, which is really good. Even for exams coming up, it just kind of gives you that that brief breakdown of each area. And again, like for respiratory, I really like the respiratory pocketbook.
Cool.
And then again, also for respiratory, there's an app called On-Call Buddy, which is really good, and that goes through treatments and assessments and how to set up equipment, and all of the precautions and contraindications. So that's quite helpful to have it all in one place on your phone.
Awesome. I think that lots of people have talked about, and you mentioned yourself that you're a book kind of person. Would I be right in saying that?
For the little ones, yes, just because they're summarised. But I'd say I am very much, I have to write it out, but then verbalise it. That's why I like practicing with friends. Even for written exams, I would have to then almost like verbalise it to ingrain it in my mind.
Absolutely. But I suppose the big point there is that it depends what kind of learner you are. If you are someone who learns by, because lots of people do that, they learn by verbalising. When I was in this study group that I was at university, we used to pick certain topics that we would kind of teach to each other, that we would kind of do like a 20-minute summary to each other. And therefore, just as you said, Izzie, we had to research, we had to write it down, we then had to verbalise it and present it. And that was the way that we learned. Some people are therefore learners by doing an activity allows them to learn. It could be that you prefer textbooks. It could be that you're a visual learner through video and online and YouTube kind of stuff, or it could be that you're someone who learns best by, as Izzie said, writing it out, and therefore it gets from brain to paper, as it were. So, Leesha, how about you? Any particular apps, resources that you found really useful in your time?
So at our university, on our course, we have access to Anatomy TV, which is a piece of software that you can see 3D images of the musculoskeletal system, I guess, and you can alter the layers that you see all the way down from the bone to the ligaments and then the deep and superficial tissue. So that was really helpful for like digitally visualizing what we were learning. So that was really helpful. And then I've also found EndNote, I think it's called, really helpful for like keeping a bank of references when working on assignments. So they're probably the two digital resources that I find really useful. And I'd just suggest like exploring your university's like library services that they have in terms of like databases to search on and ebooks. I think in my first 2 years, I relied really heavily on having a physical copy of a textbook, because it's just nice to flick through the pages and stick all your coloured sticky tabs on to mark key information and things. But kind of as I've gone from the end of second year to third year, I'm finding it helpful to utilise ebooks, particularly when it's becoming more like research heavy content. So yeah, I'd just explore kind of your online options. And then of course I just have to shout out your content, Khalid, on clinical physio. That has been a lifesaver so many times. So
That's very
yeah.
Leesha, very well, the platform that you're both a part of. But no, I think that you're spot on about the library resources, and I think identifying what services the library will offer you is really important, because there are some libraries whereby you might be able to just send an email to the librarian saying, I really need access to this particular journal article. Can you find it for me? And they'll ping it right to you.
Yeah.
And they'll search through their archives of what they can access and what they can't access, and Bob's your uncle. There you are. So yeah, that can be really useful. And of course, thank you so much for mentioning what we do on clinical physio. So we've got on the website, we've got a whole host of over 100 different free MSK assessment videos that you can look at. And then of course, we've got all of the webinars that are on a variety of subjects, from MSK to respiratory to neurology to orthopedics, all those kind of things. And all of those come with handbooks. If you're someone who likes having specific sets of notes, then we've got all of that on the website as well. But thank you, ladies. That's really helpful. So next topic is tips for exams and assignments. So Leesha, if I might be able to come to you first, because I think that if I'm right in saying, I think that you had some particular tips around exams.
Yeah, so I think when students that are maybe in first year or second year, kind of the years below me, when they ask me, I always say, like, just keep revising as you go along and keep on top of it from literally like day one, as opposed to trying to revise everything and go over everything in the few weeks running up to your exam. Because I always reminded myself, like, the knowledge that I'm revising for this exam is technically knowledge that I need to remember for like the rest of my career too. So it's definitely worthwhile putting in the time as you go along, just to keep kind of brushing over things and learning them really thoroughly. And definitely, like we said earlier, utilize your peers as much as you can, whether it be for practical skills, for a practical exam, practice on each other. Just practice as much as you can, because it all pays off and it increases your confidence in performing those skills, as well as explaining to each other what you're doing, and that kind of like solidifies your understanding of what you're doing too. And then for quite a few of my exams in my second year, they were just oral spoken exams with no practical. So that really made me have to practice how I verbalize things to explain them. And that, again, utilizing your peers for is really helpful, because you can practice explaining things to each other, or doing a role model, pretending you're a patient, just to work on those communication skills. And it makes you kind of pick out the key points of information that you're going to try and express in the short time that you have for your exam. And like a lot of those oral exams were case study based, so just talking through your case studies, demonstrating your clinical reasoning and bouncing ideas off each other. I feel like that's really what helped me develop my clinical reasoning for those exams, because everyone kind of is going to approach something slightly differently or have a different initial thought, and then just bouncing ideas off each other is really helpful. But I haven't had any written exams on my course apart from assignments, so I can't quite share advice on like a written anatomy exam or anything. I don't know if it's different for you, Izzie.
Yeah, so I'll go over like Vivas and OSCEs first, but I have had a few written exams. Someone was saying they struggle with anatomy the most. I'd say, I think it was first year, we had anatomy exams purely, and they would choose one upper limb and one lower limb joint, and we'd have to go through all the like muscle activation and the movements they do and what you'd expect as normal range and things like that. And for those, I would, as they say, I had flashcards, so I'd kind of like have all the muscles as one colour flashcard for one of the joints, and then I'd go through that with someone. So someone would be the patient, and I would just do it as if it's just for the hand or just for the hip, just for the knee, and I think that's quite helpful. With the case study based ones, our second year exam, just after Christmas, just before Christmas, we had 45 case studies to learn, and we would have one from each area. So what I'd say with something like that, if you ever have anything that horrific, is don't learn the case studies. Go through each case study. We were given them quite early on, so go through them really early on, work through what you think the assessment, treatment, etc. is, but then kind of learn it based on, as Leesha said, like the clinical reasoning. Go based on, if they've got a respiratory problem, what would you do for that respiratory problem, as opposed to this specific case study. Because at the end of the day, you're not going to memorize that many case studies. You need to memorize it based on the condition and how you would treat that. So just keep working at that. But again, saying that, sorry, I just read the comment. Saying that, as much as you want to work really hard on all of this, it's really, sorry, I've lost my words. Leesha was saying, learn everything as you go along. That's great. I would say I'm more of a crammer.
Sure.
And I do learn it as I go along, but even now I've forgotten half the stuff I've done, and I have to then relearn it. So it's okay if you don't learn it as you go along and don't memorize it, because you will forget things. There's so much covered. Just go back over it before you need to know it.
Certainly. No.
And then written. Sorry.
Oh yeah. Go for it.
And then written exams. I only had some in my first year, and I had anatomy and physiology. I don't know if they do written anymore. But again, I just learned the content. So our physiology was like conditions and the patho behind it. So I would just learn that, write it out. We were given some example questions, but I'm sure there's plenty online. Even if it's not for physio, there might be physiology degree questions set out. And for anatomy, we would have, what is the type of joint between blah de blah and blah de blah? Is it a ball and socket or whatever? And I would just, again, I'd already have that revision in place because I would have the anatomy vivas. So they do cross over. I'd say in the exam, just don't panic. And just take your time with the questions as much as you can, because you probably will know it because you're taught it in seminars and lectures, and it's probably in there.
Yeah, absolutely. But there's so much that I agree from both of you. I think that it's actually quite healthy that we've got one person in here, in Leesha, who's someone who likes to keep going as they go along, so that they don't feel like they've got all of it to do at the end. And then Izzy, someone who actually benefits from kind of a very focused at the end, right, I specifically need to revise this. And there's no problem at all with that. Again, like we said, with different learning styles, there are going to be people who have different preferences in terms of how much, how often, when they study and revise certain things. And it makes sense that you pick and you practice the style that suits you best. So don't be afraid of that. And again, if that means that you like to, if you pick a study group where you've got lots of people who like to do things as you go along, do that. And if you've got a group of people who like to do it all at the end in one specific focus chunk, then do that. I think that if I could offer any advice for exams and assignments, Izzy, you said, do they still do written assignments? Well, when I was in 2005 as a first year student, we did do written assignments in terms of physiology, but obviously that was a long time ago. But certainly in terms of the vivas or practical sessions, or OSCEs as they're sometimes referred to, where you've got a patient scenario where one of you is the examiner and the other one is the patient, the advice I would give you is make sure that your actual exam is not the first time that you've practiced that. You've got to practice the idea of introducing yourself as the physio, about going through the assessment in your head, and about going through the treatment in your head. You've got to practice that before you actually do the exam, because then when it comes to the exam, you have a really good understanding of how your brain's going to flick between one and the other. If it's the first time that you've done it, I've seen people naturally panic because they're thinking, oh, crikey, I haven't done this before. What am I supposed to do? So make sure that you practice. It doesn't have to be that it's actual exam patients. It could be that you meet up with some friends, each of you create 4 individual case studies, you hand those out to each one. It doesn't have to be perfectly correct, but the practice of going through, right, here's the information. What do I need to ask in my subjective assessment? What do I need? The practice of doing that is so important, so that when it comes to the exam, you've done it before and you know what your thought processes are going to be before you actually do. So that's my top tip in terms of exams and stuff.
What I'd say from that is definitely practice. And even if, so we had to be the patients for each other in that year group for the exams.
Yeah.
And even if you find out who your model's going to be, especially for anatomy, that's great ahead of time, because you can work out, like, if you're having to find bony markings and it's a really muscly person, you might need to work harder to find them and just learn that patient. Or it's awkward sometimes. I had to model for my best friend or like one of my housemates, and it's like you get the temptation to laugh because they're having to be a patient for you, and you just have to like practice that interaction, because it feels weird saying, hi, I'm a physio, my name's Izzy, I'm going to treat you with this today, and they're an old man or something, and you've just got to be serious. But on the flip side, don't rehearse it. I think that's the difficulty. You don't want to rehearse it, because then it will seem too structured and you will be thrown by questions that the lecturers will ask. So
very true.
I definitely say to avoid kind of learning a script for those kinds of exams. If you learn, I found that if I learned the content like generally, then I could apply it in the exam, as opposed to, like you were saying, learning it like as a script. And like we were saying before about the case studies, not learning the exact case study, just learning the content or the theory around that case study, and then whichever one you get in the exam, you can pull on that knowledge like as appropriate. Yeah.
Totally agree. No, totally agree. We've got to be able to be flexible enough to react on the spot, because I'm sure that's going to happen at some point in your career as a physio, and absolutely it will happen in your exams too. But as you've both said, that the practice of going through that process before, I think that's a great idea, Izzy. If you know who the model is going to be in your exam, even if you haven't spent much time with them before, what a great opportunity to do so. You've both got a common interest in meeting each other and actually spending some time with each other, so you might as well. Awesome. So the next topic we were going to discuss was placements, which is naturally a huge subject of discussion for physiotherapy students. And I know that we've got a question in the chat that I've been waiting to try and hold on to until this time. So naturally, this is a really big subject area, isn't it? Placements as a whole. Izzy, maybe if I might be able to come to you first about some of your top tips for being on placement, preparing for placement, doing the placement, whatever you would like to share.
Okay, so it was drilled into us by the uni to always phone them before you go on that placement. Not only is it introducing yourself, so they're more inclined to, that you've introduced yourself, you take away the awkwardness of the first day, but you also find out the information you need. Do I need to wear a tunic or a polo? Where am I meeting on the first day? What time? And then you can ask things like, what do I need to prepare? What common conditions do you see? And sometimes they say, don't prepare. Like I had a women's health placement, and we had done no teaching at uni for that. And it was quite difficult for me to prepare because I just didn't have a clue. She was like, don't worry, come in on the first day and I will just teach you as we go along, which was great. Some things you can prepare a bit more for. So I had an ICU placement, and they were just saying, looking over ventilation settings, common respiratory treatments, things like that. So it's definitely worth kind of making a list of those things. It's worth giving them your number and then having their contact details for future if you're off sick and things like that. Placement in general, prep wise, I'd say it's really tiring. It is tiring, and at the end of the day you won't want to do anything. Sometimes you need to spend that time to revise, because if it's an area you don't understand and you're wanting to kind of show your educator you're learning, you need to do a bit of revision. But again, don't go overboard, because if you're absolutely shattered on the whole placement, you're not going to take anything in during the day. And I would say, like, prep your meals at the weekend, work on days to put your laundry on because you have to wash your uniform. And just like general routine while you're on placement, I think is really important.
Super stuff. I couldn't agree with you more about being tired. I would be exhausted after a day on placement, because it's just that environment where you feel as if you're challenging your mental capacity all the time. What am I learning in this next patient? What am I treating? What do I have to do with the notes? And then your supervisor says to you, so what would you do? And you're thinking, oh, crap. Anyway, that process is really tiring. And much more tiring than when you're actually working as a physiotherapist, because when you're working, you don't have to constantly answer those questions to someone.
No.
You constantly learn. But on placement is different. And I absolutely hope that I can reassure people that if you're one of those people who feels really tired on placement, don't worry. Everyone else is in a very similar situation. So I therefore completely agree with Izzie. Make sure you're planning your time out. Make sure you're planning your rest period. I wouldn't stress about every night that I come home from placement, I've got to be working for the next 4 hours preparing for tomorrow. Sure, if there's a quick 20-minute thing that you want to research that you learned that day or that you need to plan tomorrow, go for it. But otherwise, don't feel like you have to be a battery that keeps on running all day, every day. I still did this as a Band 5 physiotherapist, that I would look at what my patients were the next day. Initially, I thought that was useful, but actually over time, I think I learned that it was not useful, because all it meant that I did was stress and stress and stress. And then I would be lying there in bed thinking, oh my God, what if they do have cord requiner tomorrow? Crikey, and there, how do I manage that? And so I found that it probably seemed helpful, but again, I wouldn't worry if you don't. And if you do find yourself really, really struggling on placement, don't be afraid to talk to someone about it.
Definitely tell them.
Your supervisors realize that you're not a machine. They realize that it's tough because they've done it as well. So if you feel like you need to say to your supervisor, I'm really trying hard, but I feel as if I'm struggling a bit, have you got any advice? Then have that conversation. It's much more important than keeping it in your own head and then finding that you're not sleeping at night. So thank you, Izzie. Those are some really, really cool points. Leesha, any tips that you'd like to share with us about placement?
Yeah, I think don't be afraid to ask for kind of what opportunities there are for you. I find it quite helpful to think of the things that I've seen on placement so far, or things that I've not had the opportunity to do or practice or see. And then depending on the placement that you're going to next, kind of take those along with you and identify the things that you feel you need to work on, or that you'd feel you'd benefit from seeing or doing, and just asking if that opportunity might be available, because you never know what they could come back to you with. So definitely like make the most of that, but obviously that's quite hard to do if it's your first placement and you don't know maybe what to expect at all, or you've not got anything to compare that experience to. So kind of just see kind of how it goes along, and just ask maybe at the start what opportunities that placement has to offer, and then you can really make the most of the service that you're with or the team that you're with. So yeah, I feel like that's kind of my biggest thing. And then if there's anything that you're unsure of, just clarify it as soon as you can, so that it doesn't delay you in progressing in any way, or it doesn't hold you back in terms of your understanding or how supported you feel. And just really, I feel like utilize the opportunity to get the feedback and learn from as many different people as you can, because there's so many transferable skills and different skills that you can learn from different people. So, and the weeks on placement go by so fast, so just make the most of it, I'd say. Yeah,
absolutely. Izzie, I'll bring you back in 2 seconds, but I was just going to say to Leesha, great shout about the opportunities, is that you really you will be surprised at some of the things that can be on offer. So, for example, if you're doing a respiratory placement and there's no ITU involvement, there's no problem with saying, do you think I could spend just a couple of days on ITU just to see what it's like? Or, I mean, listen, I know that this might be a stretch for many people. So I've heard of people on a respiratory placement saying, could I follow the person who's on call tonight? And if they get called out, I go in with them just so I can see what it's like. That might be a bit high level for lots of people. But the opportunities could be there if that's what you really wanted to learn. Izzie, come back to you.
I was just going to say, with feedback, I think I found this one of the hardest things on my first placement. Different educators do it differently, and some are more like, I guess they don't filter it as much, and I don't think they are ever doing it to make you feel bad at all. Like, if it's your first placement and you're receiving feedback to improve, it's not because you've done badly. It's because they're trying to progress you. And I think, especially on your first placement, when you're really tired, like my first placement, I had to commute an hour and something each day, and I had to leave at like 6 o'clock. And I told her in the end that I was so tired and I just wasn't progressing because of that. But just don't take it too badly. Don't feel like they're targeting you on purpose, because I think I did to start with. And maybe just verbalize what type of feedback you prefer getting, whether it's written feedback if you're not as comfortable receiving it verbally, or get them to tell you at each moment where they think, oh, you've done well, or oh, maybe you could do this better next time, as opposed to letting it build up for a week and then them just loading it on you like, you did this wrong. So definitely tell them like how you like to chat about it, even if you say, can we grab a cup of tea, and just like chat about it casually as opposed to formally, and if you find that more comfortable. And again, it depends on the educator, but usually they're quite good about you telling them. I guess it's the way you learn, the way you take feedback. So
that's super, thank you. That's really from both of you, some really great comments there. So one question that we've had in the chat, which is a very worthwhile one. Quick question: how would you advise for revising for placements which are back to back? Currently on MSK, next is neuro/respiratory step down. How would you find the balance? And so I suppose the idea there is about, you've got placements back to back, and it's about finding the time to learn and revise for what's coming up, but also not go overboard. Would anyone like to have a stab at answering that one?
I had a back-to-back placement. So after Christmas, I had a January placement, and I was on COVID ICU and surgery, and I got COVID during that placement. And then I don't think I fully had time to recover, because I then had a weekend where I had to move to a different location and go on a completely different placement. I would say that for the majority of that first placement, carry on doing as you're doing. Don't overload yourself in the evenings or weekends trying to learn the next one. Contact that following placement, the one that's back to back, and say, I'm currently on a placement, you know, I'm going to have a weekend between. Roughly what do I need to know? But just so you're aware, I won't have time to prepare. Is this okay? And just communicate with them, because they will understand that that's not really enough time to fully prepare, and just absorb the learning as much as you can in that first week to try and settle in.
Certainly. I think if I was going to give advice on that particular question, it would be very similar along the lines to what Izzie would say. I suppose there's a way of perhaps phrasing it so that you can get your point across but still seem keen, which might be the case with saying, hi, I'm really looking forward to coming to see you on my neuro placement. I unfortunately don't have a lot of time, because right now I'm on MSK as we speak, and I've only got a weekend between crossover. So if you were going to give me advice on 2 or 3 key things that I needed to learn during those 2 days, what might that be, please? So that you're highlighting, I've only got 2 days. So as a result, what 2 or maybe 3 key things should I look at, so that they understand? He hasn't got all the time in the world. He's only got 2 days to look at all this. Maybe these are the 2 or 3 things that he should really focus on. And I do think that it's natural that a lot of learning takes place on placement. That's what you're there for. And therefore, don't be afraid if you find that you haven't had that much time to learn beforehand, because a lot of learning will be done whilst you're there. And then, of course, if it means that in your first week of your new placement, if you feel like you want to play a bit of catch up with a little bit of time in the evenings, then go for that. A different question, which is a really good one from Elle. Apologies, Elle. You might be an Ella, you might be an Ellie. Any advice for remembering anatomy or vivas, as I'm on my 3rd week on my 1st year and I'm getting most of it, but not all of it? Would anyone like to answer that one before? I'm happy to answer that one if no one else has any ideas that they want to share.
I feel like I took so many different approaches to learning anatomy in 1st year. So I found using like a skeleton or models at uni, say of like the lower limb or the hand, if they were like separate, just to help with visualizing where different things are, and maybe marking where an origin is, where the insertion is. And then another thing that we did at uni was we drew on each other with like skin friendly pens. And that really helped to kind of just solidify where different things were, and then what they like felt like when you were palpating it. That kind of linked the two things together, and that made it easier to remember. And particularly for muscles of the lower limb, I can just picture like the lines drawn on my own leg. So that was quite a helpful way of learning it. And then just other than that, testing yourself maybe with a friend or a family member, kind of like a little quiz, or yeah, I'm not sure what your exam's like, but mine was kind of an oral practical exam where we got asked to palpate something or test a muscle or explain what different contents were in a certain area of the body, that kind of thing. So it is a lot to learn, but and then in the exam you only get tested on a little snapshot of it, or at least I did anyway. So it's kind of learning it simply enough that you can recall it, but so that you've got a good enough understanding of it as a whole, I'd say, if that makes sense.
Yeah, certainly. I mean, I can happily share a lot of tips on anatomy, in the sense that don't forget that it is the whole human body. There is a lot, and so it's naturally very difficult to learn everything with the most absolute succinct level of detail first time, and especially for Elle, who mentioned she's in her 3rd week of her 1st year. Very difficult, naturally. So the top tip that I always give people looking at anatomy is to try and learn level 1 anatomy and then try and learn level 2 anatomy. So what I mean by that is that if you're thinking of the rotator cuff muscles, for example, it might be that you start with level 1 anatomy. So what's the easy level of the rotator cuff? There are 4 muscles: supra, infra, subscap, teres. Okay. And then I'm going to learn that supra, infra, and teres are on the posterior surface of the scapula, and they go to the humerus. And I'm also going to learn for level 1 anatomy that subscapularis is on the anterior surface of the scapula, and it goes to the humerus. So that could be like your general level 1 learning. Then when you get really good at that, that's when you can be more specific with level 2. Right. So supraspinatus originates from the supraspinous fossa, and then it inserts onto the greater tuberosity. And infraspinatus is the infraspinous fossa and inserts into the greater tuberosity. The idea behind that is that trying to learn level 2 first can be really difficult. There's so many intricacies to it. It's naturally the more complex way of learning it, but learning level 1 first. Right, 4 muscles. 3 of them are on the back, 1 of them's on the front. They all attach to the humerus. If I can get that in my brain first, and I can really understand that, once I know that, then I can start thinking about the small details about supraspinous fossa, greater tuberosity, infraspinous fossa, greater tuberosity, lateral border scapula, etc., rather than trying to learn the complex method first. And then naturally another question, which I think it might be a good one to finish up on if you guys are happy with this, is the challenges of final year. Izzie, of course, you've completed final year. Leesha, you're obviously going into your final year, if not starting your final year now. And the question in the chat is along the lines of the fact that it's a really busy time. There's so much to learn, back-to-back placements, back-to-back assignments. Any advice for it? If I could give you my advice first, I think it would be along the lines of what Izzie said earlier about placements. It's so understandable that anybody in the world would struggle with back-to-back assignments, back-to-back placements, full-on, learning this, learning that. By the way, dissertation, by the way, job applications. So please take your time. realize that it's normal for it to be challenging. You are not supposed to turn into some super duper machine who's supposed to ace it the very second you get into your final year. So take your time, plan your rest breaks, plan time off to go home and see friends and see family, and also plan that time to be structured. I think I benefited a lot from working in study groups because I got that social aspect, which meant that I was keeping my brain happy, but also that I was learning. As we said, first part of the study session is work. Then in the last half an hour, you can chat about what you're going to do on the weekend. No problem. But yeah, really embracing that it's a normal thing for it to be challenging. So you don't feel like you need to be a superhuman, and take your time, balance things out. You know, don't feel like you've got to be there till 1 o'clock in the morning every night to try and ace it. Otherwise, Leesha, Izzie, any final tips that you'd like to give everyone? Leesha, if you'd like me to come to you first, any final tips that you'd like to give everyone on the whole subject of top tips for students?
Can you come back to me, please?
Of course I can. There's no problem at all. Izzie, otherwise, any final things that you'd like to round off with? Otherwise, I'll happily do so.
I'd say in third year, it is hard. And as you say, just like everyone's going through that, you're not the only one. Definitely plan your time off. Like, I try really hard to get a few gym sessions in a week so that I had that kind of separate thing where I just switch off. Or like my final year was during COVID, so I couldn't really go out and meet people, but I would have evenings with my housemates and we'd just like not talk about physio. We would just have a relaxing evening. But I would say, like with managing dissertation, if you've got other assignments, do them, because the dissertation is longer and there's no point. I'm not one to be able to do things like two at once. So get the assignments done. If you want to chip away at your dissertation, that's fine. And I'd say with like placements and managing those, again, I wouldn't like to have assignments at the same time as placement because you don't want to come home and have to do those. So try and plan to do your assignments like a little bit ahead of schedule. And with jobs, I think I was looking from kind of January, February time, but don't feel pressured when your friends or people in your course are finding jobs. If you're going to a different area, jobs are released at different times. And even if they're released and you're not ready to apply and you don't feel ready, I'd say it's not worth it, because you really need to find that job that you feel like you could express in an interview, like that you really want it, and you need to be in that right stage and like right frame of mind to have that time to prepare for an interview. So don't do it all at once. Wait for a break, find that time, and then go in when you're ready, because there's no point going when you're tired and just fully burnt out.
Totally with you. Izzie, some really good advice there. Leesha, anything that you'd like to add? Don't worry if the answer's no.
Yeah, I just want to thank Izzie for sharing that, because I feel like it's going to help me for my final year too. But I guess so far, just going back to like dissertations, I think if you have the opportunity to choose the topic or your research question, just make sure that you do it on something that you enjoy and that you're interested in, because then that's like half the battle won. If you're not interested in what you have to research, or you're not really enjoying it, it makes it feel 10 times more of a chore, I guess, that you have to get it done. But if it's something that you're interested in or passionate about, it's so much more enjoyable to do, which I'm finding already so far. Just because we kind of came up with ours in second year and then we continue with it. So that's kind of a nice aspect, I guess, as long as you enjoy it. And then I guess other than that, when you're on placement, just remember that maybe the physios that you're looking up to, whether they're on placement or I guess a lecturer or anybody else that you know of, they were once in the position that you are. And I just find that really encouraging, because this is just the start of your like physio career. So yeah, I think just enjoy it as much as you can, and it's exciting.
Absolutely. I think I couldn't agree with both of you more. You've highlighted some incredible points that I hope are really, really helpful to everyone. The final thing I'm going to say is, like Izzie said, with thinking about jobs and stuff like that, don't compare yourself to other people. Don't compare what grades you got. Don't compare what job they've got. Don't compare how well they did on placement. It's irrelevant, because once you finish and graduate, what they did doesn't impact your life anymore. The most important person is you. So please take your time. Don't focus on what other people do, and focus on how you're going to get the most out of your degree. But otherwise, that gives me the opportunity to say thank you so much to Leesha and Izzie. You've raised some absolutely superb points on tonight's discussion on top tips for success as a student. Ladies and gentlemen, if you're on the chat, smash the like button for these two amazing people. Really grateful to have you both on as buddies here at Clinical Physio. So once again, thank you so much for joining us. It's a good night from me. Good night, Leesha, and good night, Izzie.